I should come to Mr. Praveen. I think some of the points which you mentioned, I'm sure you could resonate with some of them, because especially the word platform, that's something which I think is something which you are so very closely associated with. Some of the points which came across from what Dr. Venkataraman also mentioned was about the talent resources, as he mentioned. Something on upskilling also becomes important at times like this, when you have certain new kind of unattended scenarios emerging. Then there is also, from the earlier conversations, also from earlier speakers as well, the element of public-private partnership again emerged as another area where something needs to be done when we look at the time ahead. And also perhaps running parallel has been this issue of guidelines when it comes to emergency services. So if you could reflect on these three aspects, perhaps in whichever order you prefer.
Well, see, of course, thank you so much for Venkataraman sir for making my life simple by taking that word platform. So, if you look at what all of the panelists are doing, or there's a lot of work that is happening in emergency healthcare. So, of course, emergency healthcare is pretty new in India. If you look at 2000 is when it started. Of course, I think as per my knowledge, Venkataraman sir did started 1062 much earlier than 108 was started. So with the pioneers like these people, Indian emergency healthcare is definitely getting a better shape. But what we analyze is from the general public perspective, they are unaware of facilities like Kokilban Hospital or Brains, or even the government facilities of MMU hospitals. So as a technology provider, our whole idea is, can we bring all these people on one single platform and make them accessible? So if I can relate them to the if I know the neurosurgery specialization can be handled by this particular hospital, if I can actually save a huge amount of time. Right, today people have no idea where do I get an ambulance. There is an ambulance standing in the next road, but they will be calling their friends and family to reach out to ambulances. So that's been a significant impact that a platform like VMEDO can bring to emergency healthcare. So it's not just a problem associated with the end public. If you look at another sort of problem, a lot of small and medium hospitals do have a challenge of finding ambulances. Assume a hospital want to pick up an emergency patient from a different region, they will find it difficult to send their own ambulances. So that's when they can rely on a platform like VMEDO to pick up a patient from a different region to their facility. See, also the second fold problem is a lot of small and medium hospitals do have a challenge in terms of managing their ICU equipments, medical equipments. That's where VMEDO comes into picture in assisting them to find the right medical equipments to the platform. So it's basically hospital has a platform where they can improvise the patient care, at the same time solve their own internal challenges of procurement, challenges of getting connected to the ecosystem. It's not just one-sided. That's why we call VMEDO as not just a platform, as an ecosystem, because we are looking at how every single person can contribute to make this better. Right, and as you rightly mentioned, the skill set. So today we have something called VMEDO Academy. So if you look at the data, more than 80% of the people were not skilled to handle such a large pandemic surge. Right. So it is unfortunate to say majority of the people were unaware how to perform a basic emergency interventions. So today ambulance drivers are more of a drivers not having a skill set with respect to saving life or handling patients. So with respect to VMEDO Academy, we are exactly trying to bridge that gap from a degree to the skill set that is required to handle emergency. There was a necessity even during pandemic and nursing. Dentist doctor who wanted to come and save life. It was just a skill set issue that was stopping them. So through the platform, we are also upskilling people through our online training modules and offline training modules. So now coming to the very important question that you talk about, government policies, guidelines, public-private partnerships. I think it's really important that government have to look at some of the policy updations or guidelines. It will be very unfair to say that today in India we don't have a legal certification requirement for ambulance driver. Any guy who have a yellow badge can become a driver, ambulance driver. So can we have a strict guidelines from a government, probably upgrading, telling that this is a certification required to operate an ambulance, to be an ambulance driver. So starting from the segment that I know, of course, I'm not a doctor to talk about the medical intervention of it. From a non-medical perspective, this is what I feel. See, even 99% of Indian home doesn't have first aid kit. So forget about BP operators, forget about BiPAP, oxygen concentrator. 99% of the Indian homes doesn't have first aid kits. So people, one, it is a connected problem between people and the healthcare ecosystem. We all should come together to solve this. I think government's guidelines. See, now after pandemic, there is a pricing put together. Like pricing constraints have come, the policies have come. So I look at even for somebody who is training CPR. So there is no guideline. I mean, we have searched from a government. There is no legal guideline like who can actually certify somebody. Of course, we have organizations like American Heart Association and so many others who is working as in certification bodies. But having said that, if India have to take this, we need more locally grown organization to come forward and solve this problem. Because with a massive population, we can't just rely on foreign institutions to solve this problem. So government have to come out with the guidelines to bring more innovations in this space, to bring more upskilling programs in this in this space, maybe introduce more EMT related programs in the regular curriculum. So I think this is where government can really play a very important role in solving this.